The worldwide medical dollar program that gives you complete freedom of choice for the best medical coverage. Hi, I'm Jerica. Welcome to my channel. In this video, I'll be talking about the VIP program, that is the dollar program of Pacific Cross BLUAL. So here's the VIP program, or the BLUAL program of Pacific Cross. When I say VIP, most of my clients who are in the high net worth category and would love to have dollar coverage get this from me. I mentioned in my previous video that Pacific Cross is a medical insurance company. Unlike an HMO company, we can reimburse your medical bills in case you went to a hospital that is not accredited with Pacific Cross. But if the hospital, like the major hospitals here in the Philippines, are accredited with Pacific Cross, your coverage is no cash outlay. So BLUAL is our dollar program. If you want a more affordable program, we have our peso program, and that is Select. What I like about Pacific Cross is the miscellaneous inpatient coverage because it is as charged. If you do frequent hospitals, you know that there are a lot of hidden costs or charges. Parang bawat galaw mo sa hospital, meron silang singil sa'yo. So, what I like about this program is, or like Pacific Cross in general, most of their miscellaneous inpatient is as charged. Just to expound on this BLUAL program, we have Plan A, B, or C. For Plan A, we have $500,000, Plan B, $1 million, Plan C, $2 million. And these are the limits. So up to $300 in one room. For Plan A, this includes overseas confinement also for Plan A, up to $1,000 for the room and board. But for this program, since it is the VIP program and since you are paying premium dollar, like top dollar for this plan, it does have a lot of good coverage. So even the professional fee, it is as charged. So it's win-win talaga, even if you know the doctor, because of course, as VIP or as people from the high net worth, I feel like one of our reasons not having coverage is because we know a lot of doctors, right? But even if we know a lot of doctors, it should still be win-win. You get covered, they get paid. So with Pacific Cross, the professional fee is as charged. Or Pacific Cross BLUAL professional fee is as charged. ICU treatment as charged. Operating room as charged. Ito lang, surgeon's fee, that's $30,000. Yeah, $30,000 inner limit. But when you go to Plan B, it's already as charged. Plan B has maternity coverage. And yun nga, as charged yung, or wala masyado inner limits, it becomes a really good or a better plan versus Plan A. Ayan. So, anesthesiologist fee, 50% of the surgeon's fee. So, around $15,000. But if you go to Plan B, it's already as charged. So, terms and conditions apply. Yes, it's better to get started early so that you can exhaust your Pacific Cross coverage, because on the first year, we only cover bacterial and viral infections. All right, sicknesses that are bacterial and viral related. Ayan. What I also like about Pacific Cross is we cover private duty nurse, and this includes nurses at home for up to 30 days after hospitalization. And as mentioned, the surgical procedures are also as charged. And these are some of the surgical procedures that we cover, and this is not an exhaustive list. So if you want to learn more about this, feel free to message me. Even in the fine print, we don't really put all the conditions or all the sicknesses that is covered. Be sure that second year onwards, if your condition didn't really appear on the first year or it's not a pre-existing condition, Pacific Cross does cover it. Some clients who are concerned that what if this condition is not in the list of coverage? More often than not, based on my experience, if it happens in the second year onwards, as long as it's hospitalization and it is in an accredited hospital and it's not a pre-existing condition, we cover. For the supplementary outpatient care, so ito yung mga consultations, etc., we do have coverage for that. So for Plan A, if you're in Plan A, then we cover up to $2,500 of your outpatient with or without the post-hospitalization benefit. But of course, if you're in Plan B, we will cover major or supplementary outpatient care without any cash outlay if it is accredited with Pacific Cross. If you are getting the Plan A, it's a post hospitalization follow-up care benefit. But if it's Plan B, and really this is a beautiful plan because even the outpatient benefits are covered with or without prior hospitalization. All major outpatient care treatments, even maternity, if you are in Plan B. Other alternative treatments, we do cover up to a certain limit. You are the type not wanting to go to the hospital, then you can still have some coverage if you do these alternative treatments. The difference between our select program and our BLUAL program is that we have executive checkups. So if you are going to look at the executive checkup prices in the major hospitals here in Manila, parang hindi ata kaya yung $200 unless it's like high precision. That's why I would really recommend you Plan B because it has up to $500 in executive check-up coverage. So be mindful also that for executive checkups, you can only get this on your second year. What I like about Pacific Cross's BLUAL versus Select, yung Select, grabe parang up to 8,000 lang yung emergency room coverage. But for Pacific Cross na BLUAL, it is as charged. We're actually a travel insurance company, we're known for our travel insurance coverage. If you are a BLUAL holder or even a Select holder, you have coverage abroad. For this program, it's 90 days. For Select, it's 30 days. So in case you're flying out of the country, you do have coverage if you have a BLUAL program, and that coverage lasts for 90 days. Next, organ transplants are included, including the follow-up treatment. But of course, this should happen on the second year onwards because it will be considered as a pre-existing condition if it happened on the first year. And then next, the coverage for our counseling and mental and nervous disorders are higher, $7,000 in case of Plan A, $13,000 in case of Plan B there. And then with continuous coverage, you will be covered for AIDS and congenital conditions. A lot of people tell me that they want the Pacific Cross coverage because of the maternity benefit. So the next one, maternity benefit. If you're looking for maternity benefit and you would want Pacific Cross to handle your insurance, be mindful that maternity benefit only kicks in on the second year. All-inclusive limit per pregnancy for prenatal and postnatal care, normal delivery, surgical delivery, miscarriage, etc., and nursery for the newborn up to 7 days, including infant formula, room and cost, and newborn screening. So yes, ang mahal manganak, right? So it's good that you will have coverage up to $5,000 for your BLUAL there. And then you can just go through the brochure. It's actually pretty self-explanatory. Although we do not have a Pacific Cross health card, like a physical card anymore, we just have a digital card that we give to our clients. And what I like about Pacific Cross, and this is also present in our Select plan, is the free child coverage. If you have a newborn, your newborn will get free child coverage after the 15th day there. And then I mentioned kanina, we have travel insurance. So this is the coverage in case something happens when you travel abroad. Core benefits do not include the optional riders. And if you're going to look at the plan, it's a bit pricey. But the reason why it's pricey is because you're getting the most of insurance that you can get. Like you're getting like the for VIP, like, and this is it. This is a lot of coverage. And if you're really someone who is scared of high medical bills, this is it. This is a suitable plan for you. All right. So it is pretty costly. That is why almost all of my clients who have a BLUAL program have discount options available. So I wanted to expound more on that for this video. So the discount options that are available for plan A is a 1,000 deductible discount, 2,500 deductible discount, and 5,000 deductible discount. So what do I mean by that? If you want to have 15% off in your BLUAL plan, we can do that. We can apply for a discount, but this deductible discount means we shoulder the first $1,000. So if you want a 30% discount, that means you shoulder the first $2,500 off your hospitalization in a given year. So for example, you spent, say, 100,000 in your hospitalization. You need to shoulder the first $1,000 first, and then Pacific Cross will cover it. And then the next one is the treatment area of limitation. So many of my BLUAL clients are seniors already, and they do apply this discount, this treatment area limitation discount. So basically, if you know that you're not going to be treated abroad, we offer this 25% discount there. So if you want to have a discount, a deductible discount, and a treatment area of limitation discount, this is what the premium would look like there. Yeah, that's about it. The BLUAL program is one of Pacific Cross VIP programs. So it's like one of the best programs of Pacific Cross. So if you want to learn more about it, if you want to have that peace of mind talaga na wala ka nang babayaran when you go to the hospital, this is what you can consider. And if you like this video, if you want to learn more about our BLUAL program, don't hesitate to message me, and I'll see you in my next video.